Good day, everyone. I'm Claire Taiko, Chief Data Scientist of Seralytics Research Services. Now, for those of you who followed our journey from the commercial to the social impact space, you would know that everything started with our win in the NASA Space Apps Challenge in 2019 for the Solution Project release or Advanced Early Detection and Exploration Service for dengue. Now, it's been a while since you heard any update on Aedes, so I figure I share some news about it. Recently, interested parties from the Latin America and Caribbean region reached out to us and they're interested in implementing Aedes in the Dominican Republic. So I'm sharing with you an excerpt of our meeting with them just to update you on where we've decided to take Aedes in the last 2 years. Check this out. Okay, so as mentioned earlier, we developed Aedes, or the Advanced Early Detection and Exploration Service for dengue during the NASA Space Apps Challenge back in 2019, and that was prior to the COVID-19 pandemic. And at that time, the Philippines also had the dengue epidemic problem. Now, we continued to enhance and develop Aedes because we know that mosquito-borne diseases kill over 1 million people globally every year. This is according to the World Mosquito Program. And also 700 million worldwide are infected by diseases such as malaria and dengue. Now, the climate change has also expanded the habitats of disease carrying mosquitoes to new geographies, now putting at risk people from locations that were previously unaffected. Dengue incidents also surged by 30-fold in the past 5 decades. And now projections from the World Mosquito Program indicate that by 2080, there could be 8 billion people worldwide that could be at risk of dengue and malaria. Now, in countries such as the Philippines, the problem is further aggravated by the fact that reporting of the cases and deaths is manual and delayed. Now, I remember when we worked on this solution during the NASA Space Apps Challenge, we had to manually encode figures from PDF files that we downloaded from the Department of Health's website. Now, we also recognize that public health resources in countries such as the Philippines can be limited. So we feel that the focus should shift from treatment to prevention. So our solution is a multimodal, multidimensional public health decision support tool that has a capacity to consider and visualize the complexity of dengue spread and risk factors from various angles, such as spatial, uh, temporal, demographic, and environmental perspectives. And at the same time, has the ability to handle and integrate different modes of data and analytical techniques. So we used for this solution data sets such as satellite imagery, Google searches, places of interest from OpenStreetMaps, meteorological data, um, demographic, uh, demographic data, and of course the dengue reports. Now to deep dive further, um, I will go through the different components that Aedes now has. So Aedes has the early warning system component, and this forecasts dengue incidences by 4 weeks ahead. And it also visually represents potential mosquito breeding grounds or hotspots in a geographical interface. Now, the mosquito hotspots have also been overlaid on the population density map to help decision makers and other actors to prioritize hotspots within populous areas or population centers. We also have the G-risk decisioning component, which explores the relationship between different risk components, so hazard, vulnerabilities, and lack of coping, um, lack of coping capacities. And this is to help decision makers understand where vulnerabilities are the highest and where systems may be insufficient to cope with the hazards like an outbreak. Now, this we feel that this is crucial because it highlights areas that may require immediate attention or sustained support to improve resilience and preparedness against uh, dengue and other related health risks. And lastly, we have the decision support component. Now, these identifies the key social demographic and environmental drivers of a location's hazard, vulnerability, and lack of coping capacity. And based on those key drivers, provide segmented actionable recommendations for interventions not only by local government units, but also health officers. Now, the actionable recommendations or the idea starters for interventions include vector control, public awareness and education, clinical management, environmental management, vaccination, as well as personal protection. We're still in the early stages of our conversations with these potential stakeholders, so definitely keep an eye on our online channels for the latest updates. Now, I share this story with you to inspire those who are passionate about data, technology, and social change. For Project Aedes, it's been a 5-year journey already, and it has been filled with a lot of highs and, of course, a lot of lows. When we started it in 2019, we didn't think that it will survive the COVID-19 pandemic, let alone still be around after 5 years. No. So I hope this inspires those who are passionate about making a difference. Remember, as Elon Musk said, if something is important enough to you, keep pushing forward even when the odds are stacked against you. So thank you everyone who watched for Project Aedes and has continued to support us. And let's make a difference one step at a time. Stay tuned for what's next.